My job here today is to just talk to you about therapy and what to expect after your surgery and answer any questions that you have, just so coming into it you know a little bit more than you did before this class, hopefully. So depending on what kind of surgery you have and who your surgeon is, they may order physical and or occupational therapy for you. And I'm going to talk to you about both of those therapies and what they really specialize in. And sometimes if you do have therapy, you'll be seen for the duration of your hospital stay, and sometimes it's just a one-time visit or a visit with a follow-up. So it just depends on your individual needs, how long you have therapy. Okay, so physical therapy, they're going to talk to you mainly about walking and how to move safely because of your spine precautions that you're going to have. And they're also going to talk to you about basic exercises so that you can gradually regain your strength and your endurance and do everything safely immediately following your surgery. Occupational therapy is going to focus more on your activities of daily living, which are bathing, dressing, toileting, grooming, eating, all those things you do on a normal daily basis to take care of yourself. And we're going to talk to you about your precautions and how those affect all of your activities of daily living. So we'll teach you different ways to do different things because of your spine precautions so that you keep your spine safe following your surgery. So the precautions that most spine surgeons follow and most spine patients have are to avoid bending, lifting, and twisting. So anything forward and down, we're going to consider that bending. So you want to maintain your spine upright and straight. It's okay to bend if you're sitting in a chair, but you don't want to bend forward or down from a chair position. Same rule applies if you're standing. You're not allowed to lean forward down to the ground to pick up stuff from the floor, to do lower body dressing. So we're going to talk to you about how to modify all the ways that you move so that you maintain your spine nice and straight. Your lifting is usually limited to 5 to 10 pounds, which is about a half gallon to a gallon of milk, and that varies depending on what kind of surgery you have. So someone will talk to you about that following. And of course, twisting, excuse me. So you're going to avoid any twisting or rotating or pivoting type movements. So we're going to talk to you about getting in and out of bed, taking care of yourself as far as bathing and dressing, and how to avoid twisting while you're doing all of those things. And then, like they talked about a little bit earlier, when you're sitting for extended periods of time, you're usually going to have pain and stiffness associated with that. So we want you to be moving around frequently. Every 30 to 60 minutes is a good time to change positions. If you're in the bed, rolling from one side to the other. If you're sitting in the chair, just standing up so that your back gets straightened out again. You just don't want to stay anywhere for too long at one time. Okay, so this is the log rolling. That is the best technique to get in and out of bed without twisting. And you can see from the picture, the first step is to bend your knees, and then you roll completely on your side, drop your legs down over the bed, and then push up with your arms to come into a sitting position. So if you do that, you will hopefully avoid twisting and hopefully avoid pain. And it's good to practice this now so that it's just kind of old habit for you after your surgery. It'll be one less thing you have to really worry about because you'll hopefully already know how to do it. All right, so when you're getting back into bed, it's the same process in reverse. You're going to sit on the edge of the bed, lower yourself down onto your arms. Your legs will come up onto the edge and you'll be laying completely on your side. Then you're going to roll like a log without twisting onto your back. So again, gravity is kind of helping you and you're avoiding twisting. Okay, so as far as walking and moving around in general, you're going to scoot to the front of whatever surface you're on. So if you're on the edge of the bed or in the chair, you're going to scoot your hips forward to the front of that surface, and you're going to push with your arms from that surface to stand. If you were using a walker, then you would grab the walker, or you would stand, kind of make sure you're steady if somebody's there to help you at first. So like they talked about earlier, if you need it, the therapist can recommend a walker for you if you're unsteady. Our hope is that you don't need a walker if you didn't use one before, but that's just something that's individually assessed. And then if you do end up needing it, we try to progress you away from the walker as quickly as possible so that you're becoming more independent as quickly as you can. All right, so like I said earlier, occupational therapy is going to be based around all those self-care things that you would normally do. And then all the advanced self-care things that you do, like cooking and cleaning and laundry and all that good stuff to take care of your house and maintain your life. So as far as meals, if you are a person who's having a cervical surgery and you're going to be having a brace up here, we want you to be pushing your plate out away from you so that you can visualize it all without having to bend your head and your neck down. And we also want you to put a napkin or a washcloth in here so that you're not getting your brace soiled with food and drinks, because that happens. As far as grooming, you still have the restriction of bending. So you don't want to do any bending forward or down when you're brushing your teeth or washing your hands or anything like that. So the whole time that you're doing anything to take care of yourself, you have to think about keeping your body nice and upright and straight so that you're not bending or twisting. All right, as far as dressing your upper body, obviously if you use a large shirt that goes on easier, that's going to be better than using something tight and hard to manage. Something with a V-neck or a button front or a zipper. So the main thing, if you use a shirt with a zipper, you have to still remember not to twist as you're getting it on, so you may need some help getting your arms in without twisting. And if you wear a brace down on your lower back, we usually want you to put something underneath, like a light t-shirt, then put on your brace and then put on your regular clothes. That way your back is separated from the brace a little bit. Lower body dressing, there are some restrictions as far as the bending, which make lower body dressing a challenge, which may already be a challenge for you. So there are two options. One is that if you're sitting in a chair, you can cross your leg up to you and you can thread your underwear and your pants and things like that. A lot of times people aren't able to do that prior to surgery and they have a lot of pain after surgery, so that doesn't always work, which is why we have all kinds of special equipment that we can show you. And that's something that you can actually practice with a therapist hands-on. So I'll show you all of these goodies. So this is a grabber, and it basically allows you to pick up things from the floor without bending. It allows you to take your socks off. If you use this little point, you can push your sock down off of your heel and grab it and pull it off without bending. You can also put on your underwear, pants, shorts, whatever it is, by putting it in here and feeding it over your legs. So you keep your body upright the whole time and you let the grabber do the work for you. The dressing stick is similar to the grabber. You can pick things up with the hook. You can push your socks off with this hook. You can manipulate your pants from the floor onto your leg. So this is just a more rigid option of the grabber.
It'd be softer against your skin, wouldn't it?
Probably. It's rubbery, so it may be, yeah. This is a sock aid. So the trick with this is that you slide the sock on and it holds it open, and then you let the string do the work so that you can slide your sock on without bending. You're of course doing all of this seated, not standing on one foot. And a long-handled shoehorn, pretty self-explanatory. Again, if you're sitting, you maintain your upright body and you can reach all the way down to your foot. All right, so when you're going to the bathroom after your spine surgery, you have to be careful when you're pulling your pants up and down and when you actually go to sit on the toilet and as you're cleaning yourself. So as you go to pull your pants down, a lot of times you would bend. You have to think about your straight posture and kind of shimmy your pants down, sometimes one hand at a time if you're holding onto the grab bar. When you sit on the toilet, you have to make sure that you don't bend too far forward. So again, you're going to keep your posture nice and straight and try and bend at your knees and your hips. And then also when you're cleaning yourself, that can bring in the risk of twisting. So you want to try to keep your shoulders nice and straight and you use your arm as best you can.
If your arm doesn't go back there.
There's a special tool that I'm going to show you in a little bit. And a lot of times wiping is easier in standing at first. So whether you have to kind of stand and crouch so that you can reach forward or backward, sometimes people find that easier in the beginning. As far as getting on and off the toilet, there are all kinds of options if you have a low toilet or if you don't have grab bars. And I'm going to show you some of this equipment later. There's a raised toilet seat that hooks to the toilet that has arms. There are just rails that actually hook to the toilet if you don't need the raised seat, but you just need the arms. And then there are actual formal grab bars that would be installed right into your wall. So there's all kinds of options for giving you support to get on and off the toilet. And we never recommend that you use a towel rack or a toilet paper holder. A lot of times patients want to do that, but that is not recommended. So if you have a vanity or something that's firmly attached to the wall, you can use that, but do not use anything that's just screwed into the drywall, like a towel rack. Okay, so bathing, you should be able to bathe your upper body fine. Again, you want to avoid twisting. But for your lower body, because you have the bending restriction, you're going to want to use something on a long handle. So it doesn't matter what this is as long as it has a handle, loofah, sponge, brush, so that you can reach all the way down and behind you without twisting or bending. And usually it's good to have somebody help you the first few times. That way if you're unsteady or you need help or something comes up that you didn't think of, you've got an extra hand there if you need it. And a shower chair, which I'll show you when I'm all done here. Sometimes that's helpful if you're unsteady or you have endurance problems where you wouldn't be able to stand for the full shower. So there are all kinds of different shower chairs, like the one on there, or there's ones with backs or arms. All right, so this is where your friends and family come in. It's really good to have chores, meals, groceries, dishes, all that stuff kind of prearranged so that you don't get home and have to do all those things yourself or wonder how you're going to do them. Typically, you will need some temporary help with something. So if you can organize a village, that's great. If you don't end up needing them, even better. But it's good to have that kind of support in place ahead of time, just so you're not going to struggle when you get home. All right, so home safety, you're going to want to take up any rugs, keep clutter out of the way, use night light so that if you're getting up at night you can see, you're not going to be running into the garbage can, the door frame, the edge of your bed. Use a rubber mat in the shower. Outside of the shower, use something to step on so that you're not going to slide. Install grab bars. So any of that stuff you think might be helpful or that you're definitely going to need, you can kind of get that in place so that your home is even more ready for you when you go. Okay, so continuing on with the home safety, anything that you use frequently that's up high or down low, you want to kind of bring that to a waist height level so that it's easily accessible for you. So like your deodorant, your shampoos, clothes, anything that you're going to really need right away when you get home. And if you do need to use a walker, or even if you don't need to use a walker, it's good to have a space cleared in your home where you know you can get from your bed to the bathroom or from your favorite chair to your bed so that you're not going to have clutter issues or get tripped up on anything. And like we talked about earlier, stocking up on groceries or having people bring you food and just arranging for general help afterwards to give you some support. All right, as far as energy conservation, so we're going to gradually increase your activity. The main thing is that you take frequent short rest breaks and you do frequent activity, but you want to keep that short. Like she talked about earlier, you don't want to go in the morning if you're feeling good all around the hallway and wear yourself out. You want to do short little walks and come back and rest. Short little walks and come back and rest. And it's going to vary based on your pain, based on how much sleep you're getting, based on how much exercise you're doing. So don't expect that because you feel good right now that you're going to feel good the next time you go walking. And same thing as far as the pain and the fatigue. Don't let that kind of keep you down. Try and keep moving frequently to see if it actually helps you feel better. Like we've talked about, you want to change positions frequently to avoid the pain and the stiffness. So that applies whether you're in a chair, whether you're in the bed, wherever you are, just so that you're keeping mobile. Frequent short walks, we talked about that. Gradually increase the distance, so we talked about that, short and frequent. If you have to go up or down stairs, initially you're going to want to limit that to once or twice a day. So if you sleep on the second floor, it's good to get up, get around, come down to the main level if you need to. Plan to stay there for the day and then go up to bed when you need to. so that you're not having to go up and down the stairs several times a day in the beginning of your surgery. The lumbar exercises, there's really not much to see, so I'm not going to demonstrate those. So yeah, you can see basically you're just pulling in your stomach muscles and tightening your buttocks so that you're strengthening all those core muscles. And you can do this before surgery to strengthen your core. And the other exercises are for your neck. And so those ones, basically you're just using your hand so that you can use your muscles to resist against. So you're going to put light pressure on your forehead, and you're going to try not to let your arm move as you push your forehead against your hand. And the extension exercise is the opposite, where your hand goes on the back and you're trying to push your hand away and you're using your arm to resist. And on the side, it's the same thing. You're holding and you're trying to push without moving. And then for the rotation one, you're holding on the side and you're trying not to turn your head. Okay, so as far as equipment goes, like we talked about earlier, this will all be assessed on an individual basis by your therapist. So you may or may not need all of this or some of this. So it's best just to kind of see what the recommendations are. So as far as walkers are concerned, there are walkers without wheels, and then there are walkers with wheels. And that's something that'll be determined by your physical therapist if you need that. As far as cleaning yourself after toileting, this is kind of an extension of your arm, similar to all those tools. And it basically holds a toilet paper or wipe so that you can reach all the way back without doing any twisting. So this is a tool that's also available.
Does it reach under?
Mm-hmm. Yep, forward or back.
You already showed these actually.
Yeah,
So,
so this all comes in a kit. All of that stuff I showed you, it's called a hip kit. Or you can buy the pieces individually. So this is a shower chair with a back, and like I said, there's all different variations of a shower chair, and that's something that can be recommended by your therapist too. And the toilet seat. So this is an example of the raised toilet seat with grab bars, and then like I said earlier, there's just grab bars that attach to the regular toilet, or there's a whole portable commode that can be adjusted that has arms as well. So that'll be something that the therapist recommends for you too.